Good evening, fellow community members, leaders, and board. Today I would like to bring to your attention how the Black community here in Georgia is struggling due to health disparities. What are health disparities? Health disparities are preventable differences in the burden of disease, injury, violence, or opportunity to achieve optimum health that are experienced by socially disadvantaged populations, according to the CDC. Simply put, there are inequalities in the quality of health, healthcare, and health outcomes experienced by groups based on social, racial, ethnic, economic, and environmental characteristics. What are some of the factors that contribute to such disparities? Access to care, poor quality of care, inadequate access to healthy foods, genetics, poverty, limits or the absence of personal support systems, and violence, just to mention a few. Now that we all have a better understanding of our purpose for this very crucial meeting, let's discuss the ones affected the most amongst my community. Unfortunately, people of color and those with lower socioeconomic status are hit and suffer the hardest. For example, I am a disabled vet of 2 different branches of service living on a fixed income. I literally have to decide every month what bills not to pay or sacrifice in order to buy groceries to get me through at least most of the month. My daughter and I find ourselves having to get food boxes donated from churches in order to make things meet, in order to make things line up, in order to take care of our appetites and our health and our nutrition. Ever since I have become a Georgia resident, living on my own without any other means of income or having a roommate, the struggle has truly been real. With that being said, I find and I buy whatever my money and prices allow, which in turn affects my quality of food intake and ultimately alters health risks and factors. So imagine or look back on moments in your life or relatives or friends' lives that you know some of their decisions were made due to substandard opportunities or opportunities or living circumstances. And think about decisions that you would have changed different if you had more means, opportunities, and resources to make better decisions. All of these decisions are not afforded to us in this community in Georgia and in lower social economic areas. This example alone screams out why health disparities are such a major concern. We are literally dying out here younger and younger. Did you know that in my community, food insecurities, housing instabilities, and a lack of walkable communities are major causes for health disease in my beautiful people of color, and it's the leading cause of death. According to Georgia Department of Health, the condition claims over 22,000 lives each year, and in Georgia, it accounts for 1 out of every 3 deaths. So how can we begin to change and reduce the margin? It truly starts with communication. It starts here. It starts in forms like this. First and foremost, vote. Vote. Please vote. I'm not only addressing preliminaries, I'm talking about state. I'm talking about select your congressmen, your state representatives. Vote. Bring awareness. We need to bring awareness. We need to become more educated and more aware of how our genetics and our economic status affects our health. Reduce the food costs or readjust the qualifying standards to provide food allowance for families in need. Having a job no longer cuts it with paying all your bills and the amount of money that is being paid as a salary. versus the inflation of the cost of living. Provide free access to health care. Provide quality food at a reasonable and affordable price. Raise job wages to fit the current inflation and continue that as the inflation continues as well. Education and resource opportunities. I can't explain or express enough how vital they are to the change of habits and our margins. Increase health literacy on affected communities by expanding educational programs. Also, cultural competency training to healthcare providers will also help with these communications and these processes in order to change policies. By improving the health outcome for minorities, we can reduce and or eliminate the gap between communities and improve our health status ranking all together. Together we can make a difference, but divided we will continue to fall. Thank you all for listening, and I hope to see changes and future works together.